The amount of anti-Indigenous sentiments that I've received in correspondence has also gone through the roof.
There is a lot of information that people just don't have. So they're making judgments and opinions based off of, what they don't know.
A North Vancouver MLA says she's getting racist emails from people upset First Nations people 18 and over are eligible for a COVID vaccine. Bowen Ma took to social media Monday, writing, "In the best case scenario, the issue is raised as a genuine question. In the worst case scenario, the comments are extremely racist. Most correspondence falls somewhere in between."
I'm receiving a lot more correspondence containing underlying sentiments that seem to imply a judgment of who is or who isn't, or who is more or who is less deserving of a vaccine. And this is quite toxic, and it is dangerous.
I'm not surprised that there is still a significant amount of ignorance around the realities of Indigenous people's lives and communities.
Cole Salem is with the Squamish Nation. He says he was saddened to hear of the public's response and points to a lack of understanding and education.
There's I would say, a consequence to individuals sort of expressing these attitudes that I think are misinformed, and it carries through to the loss of life and further harm caused to people.
Indigenous people across this country are at greater risk of serious disease and death based on social determinants of health, chronic health conditions, overcrowded housing, and multiple other issues. In fact, we've seen evidence as strong as 9 times the rate of positivity on Vancouver Island, for example, as compared to the non-Indigenous population.
33-year-old Leon Thompson says he learned he was eligible for the vaccine through a tweet and doesn't feel like there was adequate exposure and public education on vaccine eligibility for Indigenous peoples.
I don't think that I would be vaccinated today if I hadn't seen it on social media.
There needs to be more sort of proactive communication by all levels of government on the rationale for these decisions to help address the misunderstandings, miscommunication, and I think the assumptions that are being made, and as well as sort of addressing the attitudes that we're seeing coming up.
As of March 30th, Indigenous peoples 18 and over have been eligible to book appointments to receive their first vaccination. In New Westminster, Ashley Burr, City News.